Do you have burning pain or numbness in your hands or feet? Have you experienced a loss of balance resulting in falls? Are you suffering from leg cramps? Have you been tolerating restless leg syndrome? Do you consistently drop things out of your hands? Have you experienced tingling or shock-like sensations in your hands or feet? Do your hands fall asleep while driving? Have you awakened to numbness in your hands? Do you feel like you just don't have the strength in your arms and legs like you used to? These are a few of the symptoms that are associated with peripheral neuropathy. Some of you may even have been previously diagnosed with peripheral neuropathy. You may be asking yourself, so what is peripheral neuropathy? What do I need to know about it? And what should I do? Well, what you should know is that peripheral neuropathy that is not properly managed can destroy the quality of your life, as well as shorten your life. Peripheral neuropathy is a progressive condition. It may start out only as slight numbness or tingling in your feet, but then progresses, causing infections, ulcers, and eventually amputations. Peripheral neuropathy occurs due to decreased blood supply to your extremities. In other words, your hands or feet. When there is a lack of oxygen and nutrients to an area, cells begin to malfunction and die off. This causes the nerve fibers in that area to become affected, resulting in a misfire, causing numbness and pain. If left to continue, intermittent numbness becomes constant, and muscles begin to weaken without proper nerve supply. Over time, mismanagement of your condition causes the pain to become more constant, muscles will continue to weaken to a greater degree, and balance becomes impaired. All of which leads to a greater number of falls, causing more injuries. This progression then robs you of the quality of life that you have been accustomed to. Standard medical treatment is to prescribe gabapentin or some other analgesic to decrease the pain. This is palliative care. It does not get to the underlying cause of the condition. Without proper treatment, your condition will progress. Other treatment may include physical therapy to attempt to strengthen your muscles, but without proper nerve and blood supply, these results are also limited. The proper course of treatment that we use in our office allows the restoration of blood and nerve supply to return to the area and combat the underlying cause of peripheral neuropathy. We do this with a protocol that is non-invasive, non-surgical, and has no side effects. Just look at these before and after thermal scans showing the changes that this patient received in only 8 treatments. You can notice in the pre-treatment thermal scan that the toes are not visible in the picture due to the decreased blood supply affecting the heat image. In the post-thermal scan, you can see that the toes are now visible due to increased blood supply. The patient also noticed the following changes. He noticed that his restless leg symptoms were gone after the very first treatment. He also noticed a decrease in the stalking sensation feeling from his knee to the middle of his lower leg. These symptoms had improved by approximately the 4th treatment. On the 8th visit, the patient noticed that he could feel the fibers in a towel which was placed under the water bath. Prior to this, he had no noticeable sensation in the bottoms of his feet. You can check out his testimonial in the video below under Ron's testimonial. Note, all conditions vary upon length of time each patient has neuropathy and the stage of severity they are presently in. Your particular case may vary. Therefore, if you want the most effective, patient-proven, affordable solution available that has a patient success rate of up to 94%, give us a call. 570-417-7613. We look forward to helping you with your condition and getting you back on track to the life you may have been missing.